So, good evening and welcome all of you, dear participants. It's all God's grace, what He has done through unworthy people like me. And I think the credit goes to God. I thank all of you for doing wonderful work in your time. I wish and pray that you and all your family members are doing fine in the COVID season. I'm sure many of you have done a wonderful work in the front line in the COVID season, and thank you so much for it. Now, the topic Dr. Sam Siddharth had given me was pro-poor strategies and ethical practice in government service. Now, there was one doctor who shared his input in one of the magazine. His story was shared. He wanted to, he was a very socially minded doctor. He was one day, he regularly takes food in a Burger King outlet, and once he saw the burger man little wheezing. So he found that he inquired and found that he was having wheezing. So he gave one of the sample inhaler. So that man felt so much better. He thanked him a lot. So this doctor was happy. And 2 months down the line, he was wheezing again. He started, telling him, you can come to my clinic and collect it. So he used to come and collect it. But soon enough, many of his friends started coming to his clinic. And he was happily sharing these kind of stuff, whatever free he can share. And he told them, please don't share with people. It is difficult for me to manage. But people started pouring in. So what happened was, what kind of people will be, their behavioral ethics and their dress ethics compared to the paying clientele of his original clinic. So the other patients became very uncomfortable with him, and they started telling the doctor, who are these people who are coming in, doctor? So they started being very uncomfortable. So he was not sure how to handle this kind of situation. So should I allot some time for them, or should I, all these kind of now. Now, this is the dilemma of how to serve the poor, even if you have a mind for it, in a private practice. Now, in a government practice, 98% of our patients by default are the poor. So, this question of how to serve the poor is not going to arise at all. So, any patient we are going to serve in the government is a poor. So, the entire government treatment, basically, at least in our country, is a pro-poor strategy. Now, God is very interested in the poor. And obviously, we need to be very interested in the poor. The other day, Dr. Sam Siddharth was talking to me. He said he was very disturbed during the COVID season because these patients were pouring in, and in the mission hospitals also, we could not manage them. We are not a profit-oriented hospital, but who will fund these poor people who are just pouring in? It is only the government hospitals which are able to take care of these poor patients. So I started praying very sincerely for the government hospitals. So this is what Dr. Sam shared me. So we all understand in a country like India, the government service and the work done in the government service is primarily targeted to the poor. So if we want to serve the poor, and if we are in the government service, if we do our job very well, that is a proper strategy. So that is the first part of it. And I'm sure all of us know God is God of His heart is always sort of the poor, and He has told us the poor are always going to be with you. So if you remember, when Moses brought in a bunch of slaves across the Dead Sea, and he brought them to Mount Sinai. And at Mount Sinai, he was giving them the guidelines. God was giving them the guidelines. One of the guidelines was, he said, when you glean your grapes, you don't go back the next time. Leave it for the poor, the orphan, and the fatherless. You don't harvest the corners, leave the corners for the poor, the fatherless, and the widows. You know who he was talking to? He was talking to a bunch of slaves in a desert where nothing was there. He said, I am going to give you a place, and when you go to the place, don't forget that you are slaves in Egypt. And remember, take care of the poor. So, this is the kind of God we worship. So, obviously, we need to take care of the poor. Now, why do people join government service? Now, did somebody force us to join the government service? The government called us and you have to work with me? No. We chose to join the government. And some of them may choose to serve the poor and they may choose the government service. And when I finished my DM in 1998, I had joined government service after my MD, and for about 1 year I was in a PhD. Then I got a private category seat in Trivandrum at Chitrathirunal Institute. So I sort of got the permission to leave the government and went and joined. But when I came back, I was not too keen on joining the government service. My dad said, no, don't leave government service, don't leave government service. That was his only mantra. I didn't really like it, but then I have the habit of sort of following my dad's instructions, so I joined. So now many of the people who were earning more in private work and I know all these things were on. As I travel along, now I realize it was God's plan for me to work there. It was God all along who pushed me into the government service using different people. So we realize, so first we may choose government service on our own, or we may be working as a bonded rural servant, or we may, the other important thing is better option since we can't expect establish a clinic on our own. Many of us, it's very difficult to have a clinic. In Chennai, it's very difficult to pay the rent or buy a place for a clinic. So that is one reason. Other thing is the flexibility. In Tamil Nadu, you're free to practice outside your office hours. You can have your own clinic, you can admit in hospitals, you can practice in hospitals. In different states, the practice may be different, but we have a flexibility. Now, we have limitations too. There is a red tapeism, like we need to go on certain protocols, follow the protocols, do this and do that and do that, and you're always working above a chief or somebody who's above you and who does not like your principle, then that's it. And you are 10 years post DM, and one of your student who was senior to you in service who finished 2 years back, he gets promoted and he comes back as your chief, he starts telling you what to do. These kind of things are different rules are there all in the government service. So every service will have limitations. The grass is always green on the other side. Now, when we realize we chose government service on our own or because of the bond and we start working in it, at a point of time as a Christian doctor, when we realize it is God who put us there inside the work, then we understand our purpose becomes suddenly the dimensions change. We realize it's an entirely noble work. We realize it's an entirely noble work. The nobility of any job is not because of the nature of the job. It is because of the nature of the person who gave the job. So where I am, he chose it. I think Paul puts very clearly in the book of Acts that he decides where we are and what we do, what he wants us to do. As long as we are aligned with him, the very place we are in and the very work we are doing is given by him. If you look at the book Practicing the Presence of God by Brother Lawrence, I think he was just a cleaner of plates in one of the father's Christian father's kitchen. He was once asked, what will you be doing if the Lord is coming at this time? He said, I'll be cleaning my plates. So the work a farmer does in this farming, or the farmer's wife does in the kitchen, or a cleaner does while he's car cleaning, as long as we realize God has assigned us to do this, it becomes a noble job. So we all are looking at ethics. So what is right and what is wrong? Morality and ethics, these are very clearly intertwined. Now, how do we get our ethics? what is ethics, or how do we decide what is ethics? Now, we have this Hammurabi who gave the code of law so many years back, or we have Mosaic code of law. He says this is right and that is this is what you do and this is what you do not do. Hippocrates has given a oath, and we all taken do no harm. And in our Tamil, we have this Tirukural which has three pals: Arathupal, Protpal, Invathupal. This Arathupal, the first part is primarily on ethics. So how do we design? How do people decide ethics? Now, if you look at the way people decide ethics, some of them, think this is what I feel is right. If you look at a debate between the atheistic philosopher Bertrand Russell and the Jesuit priest Frederick Copleston and British broadcast BBC Radio many years back, there was a question he asked, Frederick Copleston asked Russell, how do you decide right and wrong? Russell answered, the way I decide black and blue. So Frederick Copleston asked, black and blue, you decide by seeing, am I right? How do you decide right and wrong? Russell snorted back, what else? By feeling. So this is a man who says, I am going to decide right or wrong by my feeling. Now take a dark alley by around 9 o'clock. A pretty looking girl is walking alone, and an old man who has a similar daughter, or adult man of my age who has a similar daughter. What will he do or think of? Oh my God, why is this girl walking alone? How can I help her or make sure she is safe? Now, another fellow who is in a drunk. So, what is his feeling? What is the other guy's feeling? Now, if you start deciding this is what I do by feeling, what is going to happen? This is emotive ethics. And now, subjective ethics. This is the point of time everyone agrees this, so we do this. Or, homosexuality was wrong earlier, but now in America, this is right, this is not wrong. So, subjective to various conditions, the right or wrong may change. This is subjective ethics. Then the other thing is, you can say prescriptive ethics. I told you, my father said, join common service. It's a prescription. Hey, do this, man. I tell you, I'm your dad, you do this. Sometimes we tell our children, right, as they grow up, you don't do this, you do this. This is prescriptive ethics. Then we have the utilitarian ethics. Okay, at this point of time, if I give a little bribe to this fellow, then only my job will work. Okay, I'll give the bribe, then I'll get my job done. This is utilitarian. Now I have five PGs. One PG is a sincere worker, the other PG is a scooter. And now these only two are there. I need to give the work. The sincere worker, I've already given 3 jobs. The scooter, I have not given anything. Now, the work to be done, I have to give only to the sincere guy. That's a pragmatic ethics. Whatever works, works. So people use different sources of ethics. Okay, now imagine I'm coming to my clinic or in my room. I find a beautiful cake sitting on my table in the morning. The room is open, the clinic, cake. I don't know what to do about the cake. So I may think, who's taken this cake here? Anyway, I'm hungry, I missed my breakfast, so I just gobble up the cake. It is not wrong. Now, or I take the cake and hand over to the ward boy and say, just share it with all the sisters. Well, there is not wrong. And then I decide, oh my goodness, this is a chocolate truffle. My wife likes it, so I pack it and take home and gives it to my wife. Well, it is not wrong. Or I just ignore it. It is not wrong. Or I suspect somebody has put some poison into it and or it is some dirty cake, so I throw it in the trash. It's not wrong. So I decide to take the cake and throw it in the trash. So I take the cake. I suddenly find a small note there. Doctor, you please, this is Auntie Mary. Now, 10 years back, my husband was saved in this cath lab same day. That time we were 70. Now I am 80 and he is 84 and he's still alive. So I just remembered this 10th anniversary of you saving our husband. So can you please share it to the cath lab sisters? Now, whatever options I've shared with you so far all become wrong because the cake has a purpose now. So, technically, right or wrong is decided by the purpose. Anything that goes with right or wrong, goes along with the purpose, is right. Anything that violates the purpose is wrong. So, as simple as that. So, we get right or wrong only after we decide the purpose. Now, who gets the purpose? Who gives the purpose? Who gave the purpose for the cake? That auntie who kept the cake in my table. The one who placed the cake only can give the purpose. So, what is your purpose and my purpose? The one who placed you and me in this world only can give the purpose. He can only tell what does he want us to do with this life he has given us in this world, in this body. So this becomes extremely important for us to understand. Right or wrong is based only on our purpose. So now, when we realize that, now what is our purpose? All of us have one general purpose. Now, when we know Christ and accept Him as our Lord and Savior, we become His sons and daughters. Now, but because we are born in this world, all of us are children of God. But when we accept Christ, we become His sons and daughters. He becomes our father. So, if you look at villages or you go to a father has a farm, what does the son do? He does his father's business. Now you go to a big jewelry shop. What does children do? They do their father's business. What did Jesus do? Don't you know I'm about my father's business? So what do? We are about our father's business. What is our father's business? He wants all to be saved and come to the saving knowledge of Christ. 1, 2, 3, 4 rule, 1 Timothy chapter 2, verse 3 and 4. So 1, 2, 3, 4 rule, remember, this is God's general purpose. And how He wants to achieve us? He wants us to be the ambassadors. He wants us to be the players there. Now, now this is our general purpose. Now, in addition, He has given all of a specific purpose. Now, how this specific purpose, how do we know? As we walk with Him, He will give us the specific purpose. Now, as I told you, I joined government service because my dad asked me to join. But then it was also a secure job. At least I was sure that when I came to Chennai, my salary was 6,000. In 1999, January, I got a salary of 6,000 rupees. So I told my wife, we can manage with this thing. It was okay in 1996. Now we were able to do private practice and start. And as we start our work and as I continue, and as I became a lot of desires God had put in my heart, but I could not execute many of them as I was an assistant professor. Now, when I became a professor, God gave me a couple of opportunities. I did not realize it was God who gave me. So there was a chance for me. The vice chancellor had asked me to speak in the university when the health secretary was the chief guest. And I had my topic was marching to the future in STEMI. So 2 years back, God gave me another opportunity earlier to start the interventions at Stanley Medical College. So in 2012 and 11, I started for the first time primary angioplasty as a program in government Stanley Medical College. So that was an opportunity as a part of a trial that was published in JAMA Cardiology. So with that experience, I was able to plan something for the entire state of Tamil Nadu. And God gave me opportunity to present that in front of Health Secretary. Even then, I did not know it was God's plan. Then he said, "You meet the mission director later." In fact, I went and spoke to him also after the talk that this is, I wanted to show you the slides. And I had put a map for entire Tamil Nadu and decided as to how to do that. And this Dr. Darius Ahmed was the mission director at the time. He was a medical doctor. He was quite interested and he was listening. And he said, "See, this exactly is what I have in my mind. I want to do something for trauma. Now you are bringing something for heart attack." We combine this thing in my mind. And one night at 12 o'clock, he calls me and says, "Can you share me the presentation?" And because I'm presenting to the National Health Mission, the budget. And next evening, I get the message that we have got 43 crores. Then I slowly realized, we were able to get 11 cardiac catheterization laboratories, then subsequently got 24 crores. And then, things started moving. As I was not planning all these steps, suddenly I realized it has been God who has been doing all these things and pushing me into situation. Now I very clearly know it is not my dad who pushed me into the government service. It is God who put me into the government service. Now this is just my case. It is the case of every single believer. So why God has put you, in fact, my walk with God is not dead. Let me have a disclaimer at this point of time. I want all of you to listen to this very carefully. Just because I am talking on ethical practices in the government service, I am not claiming I am an ethical practitioner. I struggle with a lot of difficulties. I fail God so many times. But I will tell you, in my heart, I don't want to fail. But I trust a God who is very pure. I trust a God who is very sincere. But I'm not sincere. I'm not. So please let me make a very disclaimer, very straight. I'm not claiming to be the type of person I want to be, or the type of person God wants me to be. But I want to really partner with Him in becoming the one. So now, when we realize that God has put us in the profession and God has put us in this job, and how do we do this in the way God is happy and God is glorified? So that is the most important thing. Now, a long time back, I was listening to a couple of talks. I think one of the talks or two of the talks in EMFI, I had taken some inputs at the time. I don't remember, maybe KV sir might have talked, or I'm not too sure. Dr. Buggies, John Maker, Philip could have talked, I'm not too sure. But somebody talked about this, about the job, profession, and calling. What is a job? A job is something we work for a salary. Job is something we work for a salary. What is a profession? Say, for example, being a nurse or being a doctor is a job. Now, being a profession is an emergency physician, is a profession. In a profession, you all want to be proficient, you want to excel. And the next level is vocation or calling. So I'll give this example. There was a man who was walking along. A lot of people were cutting stones. You might have heard this illustration. So one of the persons asked, "What are you doing?" "I'm cutting the stones. I work for a job, so I'm doing this job." So the other fellow was asked, "Hey, guy, what are you doing?" "Say, I'm making a living. So I'm just trying to make this perfect, and my boss will be good at me, good salary." And another person has asked, "What are you doing?" He said, "I am building a place where people join and worship the Lord." So he was a part of the building of a glorious cathedral. He was just cutting the stones. You can imagine Solomon's temple, and the stones were quarried not there, somewhere else. So imagine a person sitting there, and I am building a place where people are going to worship the Lord. So that is the kind of understanding that we all need to have as we work. Now, so as I told you, these ethics and all that we understand. Now, who are we reporting to? What if our boss says something that we are not too happy about? Say, for example, I'll share this question. Now, there is a certain important drug you think it is needed for the patient, and it is not available for the hospital. And you have been instructed in the beginning itself never to advise any patient to buy any drug outside. I will not think about giving the drug to the patient. I will write and give to the patient. I will write and give in a way my identity is not known. I will buy for the patient if I can afford. None of the above. So, I am not telling you what is right or what is wrong. This is just to tell you that in every day to day life, we have a lot of ethical dilemmas. Sometimes we can draw some, inputs from God, and God said, obey your masters, obey your authorities. So there is one important thing that we can have in mind. And the second part we can look at is uh, our John and I think Peter and John, they went to the temple and they were preaching about Christ. And they were not asked not to preach. They were punished and they were warned and they were sent out and said, do not preach in his name. They went again and preached and they said, what is right, to obey God's command or to obey man's command? So maybe in each situation, we will have to think that if we are asked to do any ungodly thing, I don't think we should do it. Very clearly against God's command. But in all other situations, I think we need to obey our authorities. Now, why is the drug not available? We need to look at. Now, have we checked whether the drug is not available earlier? What attempts have we made to purchase the drug? In some of the situations, some of the hospitals, if I see, when the drug is not available, one of the common reason is no one has represented to the stores and to the dean. Or sometimes some people would have written the letter and they would not have followed up the letter. As a administrator, even I am a very small time administrator. I have a lot of work which I'm not able to complete in time. Now imagine dean will have a lot of works on his table, and how will we remember Prosegrel is not available? Can you buy? Somebody has to go after it. Have I gone after it? Or if I am a professor where I could find that it is not listed in the government's, TNMSC list, have I made attempts to include that in the TNMSC? If we go back into every of these things, some of us have failed somewhere. And as a result, we are not able to really get that into our system and give it to the patient. So I am not again telling you that particular question, which is right or which is wrong. I think you need to take it in your own way. But one comfortable thing is if I can afford it, is not difficult for me, I'll buy and give. That is perfectly okay. But then not always it is possible. How often you can do? So the best thing is, how are we contributing to the system? As I told you in the beginning, the government system is one of the best system in our country to take care of in our to the poor patients. Now, how are we doing it? Are we doing it with passion? Are we doing it with proficiency? So becomes, I remember Mr. Dr. Michael Hyatt, the one who started the Hyatt series of hotels, beautifully summarize how to get job satisfaction. Well, it is a secular job satisfaction. Okay. He says, You need to be passionate about your job. You need to be proficient in your job, and you need to be profitable in your job. If you're passionate, if you're proficient, and if you're profitable, you will be having a job satisfaction. Now, we'll take that secular definition, bring it to here. Am I passionate about my job? Is my heart in my job when I'm doing it, or it's a drudgery? Oh my goodness, today's OP some 2,500 patients. I need to sign the drug slip and 250 patients. Oh my God. Is it a drudgery, or I'm passionate about doing some stuff? How can I be passionate? I'm sitting in a room with no space for breathing, no AC, and people pouring in on me. So these are some other questions. What moves me? What is that I want to achieve? What is it God wants to work with me through? Many times we think we are working, we are working. I remember one illustration I read somewhere that it was in a visit to what do you call that? Sari, silk sari place. So there is a loom, and there is a step down. The upper place, the father is sitting, down the son is sitting, and the father carefully plans and sends down the thread, and the son sits down and he must moves it left and moves it right. Tuck, tuck. The whole day, the father puts down the thread and the son tuck, tuck. If you look at what is this job, tuck, tuck, that's the only thing the son does. Now, after the end of 2 weeks, when you go there, you find a beautiful tapestry. And the father tells the son, "We have made it, man, we have made it." What? I have made this tapestry. I was doing only tuck, tuck. Suddenly you realize all along the father has been nicely putting down the threads, and the son was very sincerely just doing the tuck tuck stuff, the mundane, irritating stuff. But suddenly the father says, "We have done it." So God gives the credit for the job that He has executed through us to us. How grateful, how great is this God for whom we are working. We remember, many times we in the government service or other work, we find we do some work and somebody else takes the credit, or some ex does the work and his boss takes the credit, and some complex case is done and somebody else does the television program or press report. All these things happen, but he does the work and allows us to take the credit. I think you remember Professor Satish Dhawan when, I think this our Dr. Abdul Kalam shared this, when Dr. Abdul Kalam was a junior scientist and Satish Dhawan was the boss, and this rocket went and launched, it was failed. Satish Dhawan gave the press interview. "We are sorry we failed, but our people are working very sincerely and we'll do it." And down the line, the rocket went up well. Satish Dhawan said, "Kalam, you give the interview." This is just a model. Are we modeling like that? Are we taking somebody else's credit in our life? I remember, like this song, "As I wait, I rise up like an eagle." So this is something that, as sometimes the mundane job we are thinking, we think we are doing nothing. Suddenly we realize, God, what are the things that we can learn from the life of an eagle? He wants us to be like eagles. What does eagle do? Eagle flies high. Eagles have a vision and they focus on the vision. And they don't fly with ravens. They don't eat dead food. They don't eat the prey taken by some other predator, killed by some other predator. They kill their own prey and take it. And they prepare for excellence. They pull out the feathers come back. They, what do you call that? They sharpen their beak for plucking. They sharpen the claws for plucking. They prepare for excellence. So when God says, "You are made in my image," Imago Dei, they call. So are people seeing God in us? If God needs to be seen in us, we don't really have to say, this is the Bible, this is there in my table, and I put a screensaver of God loves you and sleep in front of my table. People walk across. I'll be a very bad representative of God. How good is our God? What is the kind of job God gave Adam and Eve? God gave Adam and Eve physical work. He said, take care of these things. So he had to cut down, water them, all these kind of stuff, prune them. Then he gave them administrative work, because he has to manage all these kind of stuff. In fact, he also gave them research work, naming them, taxonomy. He had to name all the plants and animals. He gave him relational work, a work partner. So do we think we have all these work in with us in the government service? If we want to do serve the poor in the best possible way, we have relational work. How often we touch our poor patients? Well, forget about the COVID season. The COVID is there only for the last 1 year. And maybe, God willing, it may go away early. But are we touching our patient? Are we talking to them? Are we calling them by name? Some of the doctors I know, they know their poor patients by name. They call them. They know the doctor's name, patient's name, and the patients call them at night and seek help. And they know that this doctor cares about them. So what kind of relational work we are doing in the government service? Only with the patients or the fellow workers or the administrators? What kind of relational work we are doing? Are we reflecting God in this relational work? What about the physical work that we are doing? Are we reflecting God in this physical work? Our God is a great God, it's a planning God. What kind of world He has created us, what kind of body He has created in us. If you look at the eye, what a marvel is our human eye. Every single cell is a marvel. And we are made in His image. Obviously, our work has to reflect Him, the physical work, our work ethics, the proficiency, the preparation, and the research work. What kind of research are we doing? Any place we can do research. There's a PHC or a district hospital or a government hospital. If we publish data, it is helpful for the poor. This poverty reduction strategy papers. Now, there are a couple of countries which World Bank, they have, shared, they all have to prepare, they wanted to waive off the law. This, what do you call that? Waive off the loans, these 23 countries. So this WHO expected them to prepare poverty strategy reduction for the poor. What are the stuff that you have? If you give a good strategy, then we will waive off. So all these countries sent in their strategies. Now, this was an assessment of the strategy from these 23 countries. So this strategy, very few of them had the burden of the disease of the poor in the strategy. What is the kind of spending they don't have? What is the kind of urban-rural targeting only this much countries had? And if you look at the, age-based targeting, the disease-based targeting, some of them were quite decent. There was no analysis on public expenditure, consultation of the poor. What are the pro-poor services available there? These are all were lacking. Though the expected level was here, many of these areas were not there. Now, what kind of information that we can give? Any data we generate from our village, the burden of the disease in the poor, you just sit in the OPD for and see 250 patients, just make a note, diabetes, diabetes, diabetes. And one of the days, you just go there and find out what is the reason why these people are, not healthy. Is there no place for them to work? And then maybe you can visit a school there and find out if the school has a playground which is free on Sundays. You find out, we can involve in the community and do some kind of research work. There is always place, I will tell you from my own experience. So I met Christ much late in my life. So my job was to see the patients, make sure they get the best treatment, and train the PGs. So I go late, see the patients very nicely, make the patients happy, prescribe the right kind of therapy. And when the PGs are there, I teach them in my rounds. And when the job is over, I push off. So I can finish all these jobs wonderfully well in non-OP days in 2 hours time. So then when I accepted Christ, then God told me, he said, listen, this time that you've given is for government. Government is praying for this time. So you decide your job is only this. What about the remaining 4 hours? What are you going to do? So then suddenly it dawned to me, sitting and reading itself and improving my knowledge is doing government work. Collecting data and publishing papers is government work. And creating infrastructure and creating a system is government work. Planning how to improve the care is government work. So thus, the time that we give, entirely we have to give to the government. It is not the job based. So while working in a corporate hospital, will you not be speaking about helping poor? I will just close with some of the closing thoughts. So I will just share that working in government service in India itself is pro-poor. All works done by us in the government service is pro-poor. And our ultimate reporting authority is boss. I can cheat on my dean. I can cheat on my health secretary. I can cheat on my health minister. I can cheat on my chief. I can cheat on my fellow colleagues. I can cheat on my patients, but I cannot cheat on my God. He is watching me. So when I realize my ultimate reporting authority is God, my work ethics change. So working in government service is a part of worshiping God. It's a part of worship. In fact, one of the Greek word as well as the Hebrew word for worship is serve. Latreia is a Greek word which means serving also. It's translated as worship. And shakau is the Hebrew word which is also translated as serving, also translated as worshiping. So government service, it is a part of worshiping our Lord. And whatever the job we do is a job given by God, so it becomes noble. Our ultimate source of ethics is God, as He has given us a purpose and has given us a general purpose as He has declared in the Bible, and as He has given us a specific purpose which He lets us know as we walk with Him, as we are obedient with Him. He will not give us the entire map chart of it, but definitely He will let us know step by step. So we understand thus the world calls as our job is actually our calling, and we get professional satisfaction by excelling in our work and making the poor people see a difference. Obviously, we'll see a difference. Jesus always said, go the extra mile. It is actually the word going the extra mile is from what Jesus told us. When the Roman soldiers touch his shoulder, ask for a mile, go an extra mile. But, it's very nice to be in the extra mile because there is no traffic jam there in the extra mile. Please remember, there is no traffic jam in the extra mile. So be an eagle, and remember, we are not doing this work alone. So God is with us and He is doing the work for us and through us. And so let us all do that for His glory. So one thing probably I'll just share it across to you that whatever we do, our documentation needs to be very good. Our documentation of what we do is very good. Not only we do the right thing, we also need to appear to do the right thing. So, and in case a question comes or a query comes or some interrogation or comes, inquiry comes, you are safe. So, number one. Number two is do not worry that they are not happy. Never be a people pleaser. It's very difficult to please people, but it's in fact, very difficult to please the imperfect people, but it's very easy to please the perfect God. So let us target pleasing the perfect God because He knows us well. But as we try to target Him, we suddenly realize His standards are much higher, but He still is well pleased. So, it is a very enjoyable work to try to please God. So, and as long as your papers are good, and your work ethic is good, whatever inquiry can come your way, nothing can touch you. As long as you are God, as God is with you, nobody can be against you. Do not worry. But at the same time, it is not that I don't care attitude. I care. But I am sorry you are not happy. Let me see what I can do. But just to please Him in the way you talk, but not to change the right way you are doing. But analyze ourselves. If there is something wrong in us, we can always change.